Welcome to today's webinar, Neighborhood-Based Strategies that Reduce Poverty. Today we're focusing on the wonderful Promise Heights neighborhood approach in Baltimore. My name is Devin Kerslake. I'm the community animator with Tamarack Institute, Deepening Community. I'm joined today by two very special guests, Bronwyn Mayden, Executive Director of Promise Heights, and Stacey B. Stevens, the Director at Be More for Healthy Babies in Upton and Druid Heights. We're also joined by the Director of Deepening Community here at Tamarack, Sylvia Chu, and my colleague from Vibrant Communities Canada, Alison Homer. So we have Bronwyn and Stacey with us today. Bronwyn has an extensive history in program planning, policy development, community organizing, health promotion, and marketing in the public and nonprofit arenas. As the Assistant Dean University of Maryland's School of Social Work, she's responsible for the overall performance and viability of the Office of Continuing Professional Education, the second largest continuing professional education programs for social workers in the country. Stacey B. Stevens is the Director of Be More for Healthy Babies program in Upton, Druid Heights, which is out of the University of Maryland School of Social Work's Promise Heights initiative. She has over 17 years of experience in assisting underserved women and children gain access to medical and mental health services throughout the Baltimore and the DC metropolitan area. She's worked at several nationally renowned hospitals, including Johns Hopkins Medical Center, University of Maryland's Medical System, and the Children's National Medical Center in Washington, D.C. We're so happy to have both of these wonderful women with us today. Welcome to you both, Stacey and Bronwyn. And I'm going to pass this over to you to start the presentation for us. Thank you so much for joining us.
Thank you. Thank you. We're pleased to be with you.
Yes.
So I think this is Bronwyn Mayden, and I think I'll go ahead and I'll get us started. We started Promise Heights in about 2009. It is an initiative of the University of Maryland School of Social Work. Let me just tell you a little bit about the University of Maryland. We are the University of Maryland, Baltimore. We are the professional schools campus, and we're located in Baltimore City in the Inner Harbor. We have on our campus the professional schools, medical, dental, social work, nursing, pharmacy, public health, as well as law. And so we have a wonderful group of folks to really work with. And so in 2009, we started looking around the neighborhood. The university has been here for over 210 years and decided that we needed to do much more work at the neighborhood level. Although the university is well known, our School of Medicine actually is working on 4 continents in 35 countries right now. But we decided, you know, in talking to the former president of the university, as well as talking to a number of the deans, that we really needed to extend our reach to West Baltimore, and which is our neighbor, and it's the community where the university sits. So surrounding the university on one side is the Inner Harbor, which some of you maybe have visited. It is quite a tourist attraction. It is beautiful. We have stadiums there, a football stadium, as well as a baseball stadium, casino, that type of thing there. And then on the other side, on the other 3 sides really of the university, we are surrounded by communities of mainly color, and also communities that are facing much distress, which Stacey and I will actually talk about in a minute. We are less than 1 mile from the community of Upton, Druid Heights in West Baltimore that we will be talking about and we're working on. So if you could go back to the other slide. I'm sorry, you're going a little faster than me. We decided as a mission to really begin to put together a community building model that supports the residents in Upton, Druid Heights with their educational, social, physical, and economic opportunities to provide them with the necessary tools to thrive in their schools, families, and communities. And we decided to do this, and you can go on now to the next slide. We decided to do this okay, by working with a number of partners, a number of other nonprofits. So right now we're working with about 20 other nonprofits. Primarily they are located in the community of Upton, Druid Heights in West Baltimore. And what we're doing together is we've decided to work on certain goals. On the slide in front of you, it tells you a little bit about our neighborhood. In the 1940s, in Baltimore, in West Baltimore, in Upton, Druid Heights, we had about 40,000 residents. Today, we're down to 10,000 residents. You can see some of the other indicators that we're very concerned about. Our life expectancy is about 20 years lower than the life expectancy of another community, which is about 2 miles away from us in Baltimore City. We have the lowest life expectancy in the city of Baltimore. You can see that we have almost 60% of children live in poverty in our neighborhood versus Baltimore City of only about a third. Our incomes are about 15% of, I'm sorry, 45% of our households have incomes of less than $15,000. So we're working with a neighborhood that is in really extreme distress in terms of their education, their health care, which actually you're going to hear a lot more about from Stacey in a minute, as well as you see some other housing vacancies. One of the things I need to mention to you, if you've never been to the East Coast or been to Baltimore, we have townhouses or row houses, and 1 in 3 of these townhouses or row houses are vacant in this community. If any of you are familiar with the television show The Wire, or Life on the Streets that were done, I believe, by HBO, this is the neighborhood they filmed in. So Upton, Druid Heights, so you have a real picture of what we're working with. This is our neighborhood, and it is the neighborhood that has been made famous by, you know, those television shows. So looking at that, and I want you now to go to the next slide, please. We've started to step back and look at what is the role of really a university in the community, and what is it that we're attempting to do. And so we really started to dig down really deeply. I went for an entire year to about 6 neighborhoods that surround the community. I went to almost 300 neighborhood association meetings and just listened and took a lot of notes in terms of what the needs were of people, what they wanted, what were some of their goals, what were some of their hopes, what were some of their desires for their children. And from there, we began to really think about what would Promise Heights look like. We go to the next slide. So we developed a pipeline of services that really begins at the very beginning of life with the program you're going to hear about, Be More for Healthy Babies. And then we built onto this pipeline so it goes all the way through. So we're able to serve young people as well as their families starting at age 0, and it goes all the way up to about age 24, excuse me, 24 years of age. From that, we were able to develop an agreement with about 20 nonprofit organizations. So we serve as basically the backbone organization, and I'm really talking about we're working together in terms of collective impact on almost the same goals. So it doesn't matter if you come in and you are working with us on early childhood programs, but you still have the same bottom line goal that we have, which is we're trying to make these schools, it's 5 public schools in this community, schools of excellence, schools of promise, as well as schools of opportunity. And right now, they are the exact opposite of all of that. And so we're working with the schools in terms of providing services. If you would go to the next slide, you can see some of the programs, and I will try to talk very briefly about these programs before I turn it over to Stacey. for our programming that starts with our children, our very young children like 0 to 3. We have Be More for Healthy Babies. You'll hear about that in a minute. And then we have Early Head Start and Early Head Start programs. I'm not sure whether our audience knows everything about or knows about Head Start, but these are programs that were started in the U.S. a number of years ago to try to give low-income children a leg up, if you will, in terms of education. These are programs that usually are either half-day, very few of them are full-day, and they provide children with educational learning opportunities as well as programs for parents. And they provide these programs, again, it's every day, and a number of studies have been done to show the effectiveness of programs such as Head Start and Early Head Start. Parent University is a program that we started, and it's really for parents as well as their children, 0 to 3. And Parent University provides parents with really parenting skills so that they are not using negative, using discipline, negative commands with children, so that they know and understand that they are the first teacher of their parent and of their children, and they're the ones that are actually providing a lot of the learning. It's a 10-week program. We do it once a week. We do all of these programs in the community. We do them either in schools or either churches, because churches are actually some of our providers that we work with very closely. You see there, Judy Center is a program. It's a 0 to 5 program actually, and it really provides services, umbrella services, so parents can bring their children in it. They can get tested, hearings, screenings. They can get mental health services, that type of thing, and that's in 3 of our elementary schools. At this point, I'm going to stop for 1 minute just to tell you a little bit about the programming that we have, and not just the programming that you see here. So we have in Promise Heights 4 major programs. One is Be More for Healthy Babies. The next one is Parent University that I already mentioned, that again works with parents in terms of their parenting skills, 0 really to 5. The first phase is Parent University 1, 0 to 3. Second phase is Parent University 2. And not only does it teach and work with parents and model behavior with them, but it also helps them in terms of narrowing the language gap that we have with our children, so by the time they get to school, they clearly are school ready. We also provide in those programs mental health services for children, very young children, because of the trauma that we're seeing in our neighborhood. Again, going back to the television show, it is not unusual for us to see or children at very early ages to see things in terms of parents in domestic violence situations, to hear at night gunshots. This happens every night in this neighborhood. We have a large number of the police are coming into the neighborhood, and quite honestly do on a frequent basis a roundup, if you will, where they're serving warrants and they're doing arrests. Our children many times are looking out school windows, and they're looking to see whether their parents are being dragged out of their homes. It's also a community that has a large number of public housing units. So this community of only 10,000 people, we have over 1,000 units of public housing. And so it's probably in the city of Baltimore the most dense in terms of public housing. Our third big program is what we call community schools. We have 5 schools in this one neighborhood. Now remember, 40,000 people were in the neighborhood in the 1940s and 50s. Now we only have 10,000. Right now we have only 1,900 students. Baltimore City is going through a period where in the 1960s we had a population of about 1 million people. We're down to a population of about 600,000 folks right now. So consequently, that's part of the reason why you're seeing a lot of vacant houses, a lot of houses that are abandoned, and a lot of houses where, unfortunately, crime is taking place. Our community schools are in, we have 3 elementary schools in the neighborhood, we have a middle school, and we have a high school. I have to mention again, I always have to go back to the violence, because in our high school, in the past about 160 days, we've lost 5 young men have been killed from our high school. And so as you can see, the violence is not just touching older people, but it is touching young people. We also, in that time period, lost a middle school student. Also, all of this is to street violence. Our community schools are open from 7 in the morning to about 6 at night, Monday through Friday, and they provide a slew of services so that we align our services with everything that's happening in terms of the classroom. So not only do we work with the schools to make sure that the children get breakfast, lunch, snacks, as well as supper, but in the afternoon, we're able to work with them to provide after-school programming which aligns to the curriculum. So we have right now about 500 kids of the 1,900 students in the community that are in some type of after-school program. And when I say 500, they are the ones that are enrolled. They don't just drop in the day and we don't see them for another week. They are enrolled and they're going for 4 days out of 5 in terms of after-school program. Under the third column where you see community schools, you see a lot of programming that we have going on, like the Breathmobile. Again, that's our hospital that we work with, University of Maryland Medical Center, because asthma and lead paint poisoning is so high in our neighborhood. We have a Breathmobile that is basically an asthma clinic on wheels, visits these schools, provides medication treatment in terms of asthma. And then you'll see under that Healthy Smiles a dental program that provides dental services, preventative care, as well as we're doing fluoride treatments for children that are really 0 to 5 right now in our schools. We want to expand that, obviously, to much older kids. And then you can see some of the other programming that we have in place. And then finally, we have a family stability program, which is really for the parents. It's more workforce development, getting parents into GEDs, which is if you've dropped out of school. It's a form of certificate, which is a general education diploma. And so we're making sure that we get as many parents involved in that so that they're able to get actually better jobs. And so we also provide financial stability programming, which is providing them with services such as income tax preparation, as well as counseling around the whole issue of predatory lending, budgeting. We do a number of workshops in terms of that. So I think with that, I want to turn it over to Stacey, who wants to talk in depth about one of the programs that we really are very excited about, Be More of a Healthy Baby.
So thank you, Bronwyn, for definitely giving us an overview of the work that's being done at the University of Maryland School of Social Work, Promise Heights. As she alluded to earlier, our Be More for Healthy Babies comes under our prenatal portion of our programming. And if we can move to the next slide, I really want to kind of bring the audience into an understanding of how anything that's happening in the pipeline along Promise Heights within the community and also citywide, we're talking about improving the health outcomes and educational outcomes, we have to look at what's happening with maternal and infant health. And so I want to kind of bring the audience into this discussion in this way. So we are focusing on improving community health, and we do this by improving the health of mother and infants. For those of you who are our public health fans in our listening audience, we know that the infant mortality rate reflects the health of not only nations, but also provinces and states and communities. And here we see that in 2015, about 4.5 million infants died globally. And when we look at where the United States is ranking over the last several years, we're coming in at about 24, 25, or 26. So not doing too well. If you can flip to the next slide. So when we're talking about what's happening within the United States, our work is on the East Coast, as Bronwyn alluded to. And so we're on the East Coast. We're in the South. We are below the Mason-Dixon line, and we're situated within the city of Baltimore. When we're looking at the United States statistics as it relates to infant loss and also fetal loss, the U.S., as I stated earlier, is historically wealthy, but it's not being reflected in what's happening across cities, across communities. We are still experiencing infant loss, and that infant loss rate in 2015 was 5.87 per 1,000 live births, and we still were experiencing about 1 in 4 miscarriages. Again, that's speaking to the health of mothers, and how that health is being impacted is largely environmentally within the communities that we serve. So when we look at the infant mortality rate in Maryland and also Baltimore City, in the state of Maryland, infants are dying largely because of birth defects first, and then babies are being born too soon, weighing too little, and lastly, because of unsafe sleep practices. However, when we flip the tide and we look at what's happening in Baltimore City, infants are dying because of unsafe sleep practices and because they're being born too soon and too little. And so this kind of presents to you what our infant mortality rates have been in the state and also in the city. And Bronwyn alluded to when Promise Heights started in 2009. When we look at Baltimore City, our infant mortality rate was 13.5 per 1,000 live births. Fast forward after we have been doing major work across the city and very strategic work within this community of Upton and Druid Heights, we now have reached an infant mortality rate of 8.4 for 2015. And let us note that the infant mortality rate is not only declining in Maryland, but tremendously in Baltimore City. It is the lowest it has ever been historically recorded. And so we're very proud of that work, and we're going to speak to how we've been doing that work in a few minutes. So Be More for Healthy Babies is a citywide initiative and a community initiative in 2 communities. Our focus is making sure that all babies born are born healthy and have a healthy weight full term and are ready to thrive in healthy families. This work was started citywide in 2009 as well, and it was led by our former mayor, Rawlings Blake, the Health Department, the Family League of Baltimore City, and Healthcare Access Maryland. And many stakeholders across the city have been doing this work very strategically. It is work that has required work on a multi-level approach, so we have not been able just to focus on things that are occurring on the individual level, but we're also interested in what's happening at a systems level, what's happening with our policies within our hospitals upon delivery and post-delivery, and making sure that infants are going home to safe sleep environments. Next slide. This initiative is also addressing the social determinants of health, which I'm sure many of you in the listening audience are aware of. These are the factors that include where we live, where we work, where we play, where we worship, and how those factors impact our health, and I would dare say our educational outcomes, but for health, more so than the visits that we make to our doctors. So we're talking about some of those housing conditions that Bronwyn was alluding to earlier, living in compressed housing conditions and how that impacts not only asthma rates, but also residents who are smoking and creating unsafe environments for infants and leading to infant death. We're talking about food access and how that impacts pregnant women during the course of their pregnancy as well. Next slide. So with this citywide initiative, this is a very busy slide, but it's an important slide because it really shows the framework that's guiding all the work that we do. Very much like Promise Heights, what we do is we're taking a life course perspective. We're looking at what's happening across the lifespan. We're looking at what's happening with the woman, with the expectant father, before pregnancy, during pregnancy, and after pregnancy. We're addressing several other short-term determinants of health, such as smoking, such as nutrition, such as intimate partner violence, but very much interested in doing the work of addressing poverty as well. Next slide. So Bronwyn mentioned that a lot of our work is happening at the state level, at the city level, coming through Maryland. Many of you know that Maryland is a very wealthy state, and that in 2014 the median income was $75,000. These are some of the things that Maryland is known for. And as it relates to our city, many jurisdictions in Maryland do not share that same wealth. And Baltimore is one of the poorest regions in our state. And here are some of the things that Baltimore is known for. But additionally, Baltimore is known for having pockets of communities where there is generational poverty. And so we look at this statistic right here, poverty in Baltimore City. When we're looking at Baltimore versus the United States for low-income children, there are 61% of low-income children residing in the city of Baltimore versus within the United States. And so what does that number look like for those who are living in poverty? Next slide. We're talking about a family of 4 existing off of $23,850 per year. And who is this most impacting? About 1 in 4 residents in Baltimore City, about 40% children in female-headed households in Baltimore City, and as we said, within our specific community, about 60% of our children are living with this standard of living currently. Next slide. So Baltimore is a city of about 225 neighborhoods. Each neighborhood has history, story, culture, people, legacy, family, food, traditions, and beliefs and practices. Next slide. That includes the community of Upton and Druid Heights. This is a picture of one of our fantastic murals that was done, that hangs in our community and really kind of accounts to the rich legacy. But it also, our community also has to deal with many of the neighborhood challenges, such as the blight. So really what you're looking at, and this is, I'm sure this is not only true here in the U.S. and here in Baltimore. I've had a chance to travel in Canada as well. We're talking about how we show up having a tale of 2 cities. Cities where we have such beautiful murals and thriving economies. However, we have pockets of concentrated poverty where about 40% or more of the residents are living on that $24,000 a year for a family of 4. And so they are dealing with facing very adverse challenges because they're living in poverty. Some of these challenges, as many of you may be aware of, are housing issues. Am I couch surfing? Am I moving from relative's house to one relative in order to live? Do I have stable housing? Do I have great access to food? Or am I relying on a corner store that is filled with high sodium canned products that are really not helping my health outcome? How is transportation? How am I able to get to work? How am I able to get the kids to school? So these are the day-to-day decisions that folks who are living in poverty have to address. And ultimately, it's impacting them in a very stressful manner and impacting their health outcomes. I want to also note here that in living off of that $24,000 for a family of 4, about 35% of that income goes to energy expenses. And so what do you do with the rest of that money in order to survive? So this comes to the collaborative approach, the work that we're doing in Upton and Druid Heights through Be More for Healthy Babies in our place-based initiative. It is a collaborative approach. We are addressing the challenges by really shoring up the resources that pregnant women and expecting fathers need during this critical period of pregnancy so that they can have a fantastic birth outcome. And this relies on us to rely heavily on building trust with parents, on getting to know residents, talking to businesses and informing them about the infant mortality rate within the community and ways that they can support a pregnant woman. It requires us to really lean on our churches and our faith group organizations to provide food and places of shelter when people are stressed, and places of fortification for their spiritual growth, and also working on those organizations such as the University of Maryland to provide other professional services to help to fill in some of those needed gaps of services that folks may be in need of in the community. Our approach is also, next slide, very much strength-based and asset-based. Here's a slide of two of our barbers who work fervently within our community to educate men about the risks of unsafe sleep practices to infants when they're brought home, and to infants who are in their care. They work to educate men on how to improve their nutrition and how to decrease the stress of pregnant women who they are partnering with. And as a result of a lot of these partnerships, we are fortunate to say that over the last 3 years, we have not had any sleep-related deaths, no SIDS-related deaths within the community of Upton and Druid Heights, and it's largely because of these collaborations that we have. Next slide. Other assets that we have neighborhood spaces, libraries in which women can go and bring their children and start that learning process and closing that 3 million word gap through going to the library and improving their literacy and looking for jobs on a lot of the computers that are within that library. We have the Y Rec Center in our community, which hosts our Be More Healthy Babies Fit program, in which women can go and help to reduce weight that they may have gained after pregnancy, so they can be prepared for the next pregnancy and really help to decrease any other comorbidities that may have existed before pregnancy in that Y facility that's in the community. So this brings me up to, next slide please. A lot of the work that we've been talking about has been around outreach and education in the community. We've been doing that over the last 6 years. And so over the last year, we have formed a strong partnership with Tamarack. They've come on board to support this work because we recognize that we need to deepen our community engagement with residents. And we really want to hear and find out from some of our most vulnerable citizens kind of what is their vision of a healthy community? What are their gifts and talents that live within them? And so we've been hosting 20 conversations over the last year. We've had an opportunity to meet about 500 residents or so, and we've asked them these various questions, these 5 questions that are about to pop up, because what we recognize is that over the past 6-7 years, although we've been improving, decreasing the infant mortality rate, improving the health of women and children, we really want to do a shift and turn this work over to the community in which we work. And so these are the questions that we've been asking residents over the past 5 years, and it has been probably the most invigorating work that we have done thus far, and to hear their input and to hear their insight into what it is, what their vision is, and what what lies within the human element of what in their hands and what they're able to contribute to this community. It's been very exciting. Next slide, please. So in looking at Tamarack's continuum of engagement, definitely over the earlier years of our work, we were hitting along that informing and consulting area. We were out informing people of the risk factors to women as it relates to infant mortality rate, how smoking and how substance abuse may have impacted the health of their baby. But now we have shifted more towards the involved and the collaborative piece, where residents are more participatory. They're participating, they're giving us feedback on our resident-led neighborhood action team. They are helping us to direct the work that we're doing, and it's just a very exciting time. And so I want to share with you some of the concepts, some of the skills that we identified, and some of the information that we've collected from residents over the last year. If you could just pop up all of those, please. Definitely, we've heard over and over again from the elderly and also from the youth that they would desire rec centers and facilities in which youth have a place to go and engage in sports. They have a place that kids are safe after school. So we've heard that across the age spectrum. Next, we've also come across individuals who have various gifts. We've run into individuals who are able to make dresses, who sew, who are seamstresses, and they are interested in supporting young girls when it's prom time. They want to come in and support girls who can't afford to buy prom dresses so they can look beautiful. Others are interested in helping young women access food in a very different manner by driving them to Sam's Club. And I think you guys have Sam's Clubs in Canada, so that they can access food that is more healthy and in a larger quantity. So these are some of the things that have come from residents. In addition, next slide, we have been so excited about some of the assets that we found in people. In our community, we have people who are problem solvers, those who are dancers, drummers, writers. I just attended a community conversation earlier this morning, and a woman was a cosmetologist, and she was educating women about how the products they use in their hair, how it impacts their overall health, and also what they put into their bodies can also impact their hair. And so it was a very interesting conversation, and she wants to lead workshops in some of our middle schools. And so we'll try to definitely get her connected to our middle schools and those who have similar skill sets. So it's been really, like I said, very exciting work that we've been doing, and even residents have been thrilled about what gifts and talents and skills live within Upton and Druid Heights versus some of the urban blight that we see on a day-to-day basis. Next slide, please. So here we are. We have some examples of us doing our work in the community with those community conversations. Next slide, please. Next slide. And we've even gotten our community partners involved. You can pull up all those words. Those community partners who are doing the work with us in this collaborative manner wanted to be a part of these community conversations. And they came up with words that they see that really embody the residents of Upton and Druid Heights. And these are the words that they felt, that they saw within our residents. And so what we want to do with these words is to maybe put them on a T-shirt that residents can wear, really denoting the spirit that exists within Upton and Druid Heights. And last, so we have done this work. We entered this work to really decrease the infant mortality rate, to improve community health, and improving community health, we're improving educational outcomes as well. But along the way, we have found jewels that exist within residents, and residents who are willing to collaborate with each other to improve in a very sustainable fashion the work that has been started. And so we have a few more community conversations that we have to do. We've made sure to include definitely the youth, and we have done community unveilings in which we have shared some of the results that we have received across the neighborhood, and we're starting to get prepared to do community projects that will be resident-led as well. And so that concludes the work that we've been doing, and we are aware that in doing this work, we have definitely impacted poverty within the community of Upton and Druid Heights. This is our team. You guys see Sylvia there. We consider her part of our international team as well.
Bronwyn, Stacey, wow, this is incredible. Thank you so very much for sharing some of your work. What I'm finding really inspiring is, you are absolutely looking at system-level issues, looking at the comprehensiveness of the social determinants of health, and yet at the same time, finding ways to act very locally, very concretely on the ground in these neighborhoods and make positive change happen for the youngest residents of the neighborhood, obviously, and their families from a beautiful strengths-based approach. So thank you so much. this is the part of our webinar where we're doing a shout out to all our folks that have logged in, and I know some folks have logged in solely by phone, which means that they don't have the capacity necessarily to sort of type in their questions, but we would welcome questions from any and all of you, and or comments, feedback that you have to share with Stacey and Bronwyn. And maybe while we're waiting for folks to chime in, I guess maybe I want to kick it off with a really interesting, with a really kind of question that's been bubbling for me. And that is, you know, you've done a lot of work in the last year to really kind of build a foundation of leadership with the residents of Upton Druid Heights, who themselves, you know, are many of whom, as you said from your data, are folks that are in low income. What advice would you offer to others on the call today who are eager to really engage folks with the lived experience of poverty in the work that they're building and doing?
So, I mean, one of the things that I think is really critical about all of this is the importance of meeting people where they are and really taking the time to establish trust with folks. And when I say meet them where they are, so a lot of us, you know, do this work 9 to 5, right? And so really, residents may or may not be in the community between 9 to 5. They may have jobs, or they may be in the community 9 to 5. But really meeting them, you know, where they are organically. So I know when we started our neighborhood action team, a lot of that organic work happened when moms were dropping off children to school. And so we took the time to reach out to them, to get to know them, to start planting the seeds of trust and establishing trust with them and being consistent. So maybe showing up after school and talking to the same moms who was standing around having great discussions about the night before and how challenging it may be to you know, juggle, being a mom and juggling. So that showing up where people are and coming out of our own comfort level. So, you know, many of us work in organizations and buildings and what have you. So we've got to move ourselves to where people are. And that may be, you know, on the corner, right before school. It may be walking on the track, the neighborhood track. It may be standing at the bus stop. So coming out of our comfort zone to meet people where they are and being consistent in those efforts. Because people are watching to see, did you just show up today, or are you going to show up the next time? And maybe the next time they may invite you to their child's birthday party, and so forth. So that's how you're establishing, you know, rapport and building trust, but you've got to be consistent with that. So that to me is a tremendous factor.
I think I want to add that it is about the relationship. It's all about that, and it's everything that Stacey said. But without the relationship with an individual, then you're not going to. You're not going to get anywhere. And so I think you have to build it one-on-one. In addition, we think that we're attempting to model some behavior so that people see how we do things like advocacy. We are right now fighting the closure of our high school. It would be very easy for us to just go to the school board meetings on our own. But we worked with our students so that they decided that they wanted to testify. So many of them decided, well, you know what, I have a job after school. So they wrote letters to the school board, which other students delivered to them. Others decided that they wanted to testify. So we worked with them in terms of how do you do the testimony in 5 minutes, because that's all you have. Others said, no, I'm an artist, and they made signs. So what we did is, again, met people where they were, like Stacey said, but really tried to reinforce and to help give some confidence to them to say, yes, you can do it. And then finally, for most of our programs, we attempt to hire. One of the things I'm not sure if Stacey said is that her outreach workers, her community health workers are all from the community. And I think that that is one of the biggest lessons that we have, is that we try to hire staff. And what we did is we have a young woman, I'll just tell you this very quickly, who just got her doctorate here at the School of Social Work, and she evaluated Parent University, whether you got better outcomes if you had an MSW running the sessions, or you had a neighborhood person, which was trained, running the program. And guess what? What she found was that it was just as effective with having Miss Linda, who has a high school diploma, running the session, as that you have with an MSW running the session. And so we take that and we go as far as we can with that.
Right. And to that end, when we're looking for referrals, like who's going to tell folks about our programs and the services that we provide? Word of mouth. But definitely women who've gone through our program, who receive our services, are the ones who refer others, who are out there not only sending pregnant women our way, but also out there spreading the word around our messaging. So they become champions as well.
Wow. So you really are reinforcing how those relationships of trust take so much time to build, but they are so foundational to how you are doing what you do. Now we have a question here that came in from Ashley, and she's really curious around how are you tracking success and what measures indicate the program is making impact. And I'm presuming, Ashley, that you're talking specifically about the Be More for Healthy Babies program, but I'm not sure. I'm trusting that. So can you say a little bit more about how you're measuring and monitoring success generally, both in terms of the program overall and some of these initiatives also?
Right. So we are tracking our work definitely individually. So we have data collection forms that we fill out when a woman enters into our program. And I want to say, in addition to those, we also have a strengths page that we have women write down all the strengths that they have in coming into the program. And so we assess those, the data forms, and we have them complete them at the beginning and post-delivery, and then we have them fill them out every 3 months until their babies are 18 months of age. And basically what we're tracking, what we're looking at, is their risk factors, such as smoking, other comorbidities, substance use, versus their protective factors, their family support and their social support, their breastfeeding and things of that nature. And so if Ashley's interested, I can definitely send her those outcomes. We have very strong outcomes as it relates to the women who are breastfeeding for the first time, and showing women who are breastfeeding over several months, so up until the baby is at least 3 and sometimes 6 months of age. We have strong outcomes around getting women engaged in mental health services throughout their pregnancy and thereafter, and also women who are relying on the protective factors of their family support and other social supports. So yes, we are monitoring them, and we have fantastic outcomes in that area as well.
For older students, we are looking at, we use efforts to outcome, which is basically our data management system. And for the older students that are in the public schools, we really are looking at 4 items. We're looking at the attendance, because we know that the attendance has in it, it can really help us predict, unfortunately, whether a young person is going to continue at school or either is going to perhaps drop out. We also are looking at their grades. We look at standardized tests, as well as we look at their behavior. And so some of those things are considered parts of an early warning system, particularly the behavior, the testing, the attendance, that will let us know, unfortunately, whether we have a child that is looking that it's either going to go one way, which is looking to drop out and to be on the streets, or either they are looking, in terms of moving forward. So we're able to track all of those. We get it aggregately so that we know every 4th grader, but we also get it now. We just gotten approval from Baltimore City schools that we get it on an individualized basis also.
Fantastic. I'm looking at our clock and getting a flag that we probably have time for just one more question before we wrap. And I'd like to, Kyle Pakeman sent us a question saying, thank you for a great presentation. There definitely seems to be some similarities between your approach and the Harlem Children's Zone in New York City. And so he says, would you say that the Baltimore approach to poverty reduction is modeled in a similar way? Question. And then also, are the community schools that you are referring to charter schools?
Okay, this is Bronwyn, and let me try to answer the question. Yes, in terms of the Harlem Children's Zone, but you need to understand that they are a model that has been working for over 20 years. They are fantastic. They have a budget of about $165 million. The other thing where we're a bit different is that they do everything themselves, where we're using a collective impact model. We cannot afford to do everything like the Harlem Children's Zone, so we bring in partners that are able to do a lot of the things and do them well. So yes, we are following that. We're part of a neighborhood movement or a national movement called Promise Neighborhoods. So you have about 50 of us all over the country where we are mimicking, if you will, actually the Harlem Children's Zone. And the last thing I want to say is you've got to remember Harlem now is not like Harlem when it was when I was in college in the 70s, but Harlem is now a community where it's easily to buy a house is $50,000, $60,000, $70,000, $1 million, you know, just to purchase a home there. So it's not the Harlem that, you know, of high poverty that when Jeff Canada started about 20 years ago.
Wow, so inspiration for sure, it sounds like, from some of the learnings that they've had there, but also a very unique spin that you are tailoring to the reality of Baltimore, which is fantastic.
Yes. And the final thing I'll say is that, yes, we do have one charter school, and it's a year-round school. So we can give more information on that later.
Lovely. Well, ladies, on behalf of all of us, I want to thank you again for the generosity of your time and your wisdom. It's kind of inspiring, in spite of some of the dire data that you shared at the outset around the challenges being faced in the neighborhood, to see that there's a lot of strength and a lot of positive momentum being built there as well. So thank you so much on behalf of all of us for sharing, and I'm going to turn it over to Devin now, if you don't mind, to wrap us up if there's anything else.
Yeah, thank you. Thanks so much, both of you, for your important work and for sharing it with us today. It was really exciting to hear about, and I'm sure we're all leaving feeling pretty inspired as well, especially since this is the third part of our series on neighborhood-based strategies that reduce poverty. So we just feel so lucky that you came to share with us today. Thank you. I just have a few more slides to share just as before we say goodbye today. You can stay in touch with Vibrant Communities Canada, Cities Reducing Poverty, and you can stay in touch with Deepening Community in two ways. There are monthly newsletters, and we have the links here on your slides so that you can join in if you haven't already been receiving those. You can have monthly emails with great content, lots of good resources, links about this kind of content. As well, if you haven't gotten acquainted with our learning communities, we have a few ways you can learn more. Deepening Community explores programs, policies, and practices that strengthen communities and neighborhoods, mobilizes citizen leadership to enhance social capital. Our members are a network of people who are partnering with Tamarack Institute to explore the unique role that neighbors, neighborhoods, and communities play in creating positive futures. And as well, Vibrant Communities is another one of Tamarack's practice areas. This is a pan-national network of place-based poverty reduction initiatives in more than 50 regions across Canada. Their members work at the community, municipal, provincial, territorial, and federal levels on poverty reduction. The VC Network has just begun a consultation process on their innovative Game Changer framework for strategy and evaluation. So if you're interested in learning more about the priorities and strategies that have the biggest cascading effects in poverty reduction, you are invited to visit the website or subscribe to Cities Connect, the newsletter that I mentioned before. So yeah, in a few days, you will receive a follow-up email with a link to an audio recording of today's call. You'll have a copy of the slides that were looked at as well. And any other kind of resources, maybe lingering questions that didn't get answered, we will do our best to collect all of those and really give you some more information on this topic and on this amazing work that Stacey and Bronwyn are working on to leave you with. And I welcome you to give us any feedback on today's webinar, and I'm so glad you joined us today. Thanks very much. See you soon.